You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know about dental implants. My second guest is Dr. Koos. He is an oral surgeon. We've invited him on the program today to talk about what you need to know about dental implants. Hey, welcome to the show.
Thank you.
Dr. Koos.
Pleasure to meet you.
Now, we've had the periodontist on the show. You're the oral surgeon. You do similar things. Tell us about your role there. You do the surgery. You place the dental implants.
Well, as surgeons, myself and our periodontist, we both place the dental implants, and then we have a prosthodontist that restores those implants and puts a natural crown on those
Would
implants.
everyone agree, every dental, general dentist, everybody agree that a dental implant is always better than a bridge or a partial?
They should, when indeed it is. It's the only tooth replacement procedure that actually preserves bone, and that's critical because once teeth are lost, the stimulus through the root system for the surrounding bone is lost. Okay. And as a result, bone tends to atrophy, facial lower third changes in appearance.
Your face starts to sink in a little bit?
Correct, the lower third does,
okay.
As well as creating situations where other teeth that remain are overstressed, and dental implants really replace natural teeth in a natural way.
Is it also true that you could do this in one day? I mean, certain denture wearers could go in, you give them 4 implants, and in one day they go home and they have their teeth, something locked in their mouth.
Correct, and not everybody qualifies for that, but most patients do, and we utilize state-of-the-art technology with cone beam 3-dimensional CT scans that enable us enable us to do computer-guided surgery. And what that does, in addition to make the treatment more rapid, it also allows us to do minimally invasive treatment, which is very important.
So the surgery of today is much different than the surgery of 5-10 years ago?
Much less invasive, much more sophisticated in the treatment planning process. So we can actually do surgeries on the computer model, calculating and taking into account all the differences in unique anatomy for each patient,
okay.
and thereby deliver the best care and have the implants in the most precise position for each patient.
Going into this interview, my mother, 73 years old, told her about what we talked about on the telephone, and she's been in dentures since she was 28. She's 73 now. She says she was told she was too old. And that's in contrast of what you told.
That's unfortunate that she was told that.
I mean, is that a common belief, by the way? You're just too old, and you say 73 is young if you have.
Correct. It's 73, 83, 93. We have patients in their 90s. Their needs are really no different, and their desires are no different than someone in a younger category.
But why would somebody 90 want to get dental implants?
For improving their quality of life, for having a more normal diet, for having better nutrition. It boils down to chewing and being able to chew in a normal fashion, which quite often is not accomplished with traditional dentures.
So what if somebody has a little bit of osteoporosis, or they're on certain medications? Can they be candidates for dental implants?
Absolutely. There's many patients that we see that have a host of medical problems, and we assess each patient individually, but those patients are often very good candidates still for dental implants, whether they be single tooth, multiple tooth, or complete denture replacements.
What about the dental implant falling out? I mean, do they fall out?
Interesting you ask that, because that is a misconception. In fact, the ADA shows that dental implants are the most successful dental treatment available, over 95% success rate,
okay,
with longevity of 40+ years and counting. And
so they will last as long as a regular tooth, maybe even longer?
Correct. There is nothing organic about an implant, meaning it's not subject to decay, and it withstands chewing forces for a lifetime.
What about pain, though? Seems very painful having this done.
Well, that's actually a misconception. Most patients state that they feel little to no discomfort during the procedure or after. We have a variety of ways of making them feel comfortable. They really don't feel anything during the procedure.
So during the procedure, they don't feel anything?
They can choose to be sedated, and they don't feel anything.
Okay.
And it's a pleasant experience.
What about afterwards? What about after the surgery?
Post-operatively, most patients just require a Motrin or 2.
1 or 2 Motrin, and that's it? And how soon could they eat after the procedure? In an ideal situation, like for the denture where you say 4 implants, how soon can they eat?
Ideally, placing in an immediate implant-supported denture, they can eat immediately. And
right after the procedure?
Right after the procedure. And since bone is devoid of any nerves, there is no pain with the pressure from the eating. And the wonderful thing that we have as well, mentioned earlier, was the 3D cone beam CT technology, which allows us to do what's called flapless surgery, which is a minimally invasive placement of the implants.
So there's thousands of people, obviously, in Chicago that are missing teeth.
That we know of.
That they don't.
There's,
and you say if they knew the benefits of dental implants, they would get rid of their bridges, partials, get rid of their dentures.
They'd be in
you
the
believe
garbage.
that?
They'd be in the garbage. Absolutely.
Not an overstatement on your part.
Not at all. If we had the ability, and I wish we did, to enable each patient to try how an implant-supported denture or an implant feels in relation to a natural tooth, they would love it.
Okay, is this true? Denture wear, 2 implants, and we're just about out of time. 2 dental implants. Give them something snap in, snap out.
And
is that right?
That alone can make an incredible difference in somebody's life, an incredible difference. Lower dentures, traditionally very unstable. People don't like them. They have them made, and quite often they wind up in someone's bedside drawer.
Okay.
In this situation, the patients are very, very pleased with their outcome, and it can make a tremendous difference.
Do you think people count their teeth and think, wow, that's going to be very expensive to do something?
That's another misconception.
There are really 2 or 4 implants, and you're saying, in the right candidate.
Correct, and over the long term, implant treatment is actually more cost effective because you're not recouping certain things that occur with poor healing and with long time use and bone atrophy and things like that.
I want to thank you for coming on the show. Very nice.
Thank you.
Very interesting. Now up next we have Dr. Toljanik.
Correct.
He's a prosthodontist. He's the one that does what? He puts the tooth on the implant.
Yes, he is a board certified prosthodontist, and he restores all the implants that Dr. Singh and I place. Meaning he puts the crowns on, he makes the fixed dentures, and he makes everything look beautiful.
All right, I want to thank you again. Very interesting. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Up next, more about what you need to know about dental implants. We'll be right back.